5 years ago, I was pregnant with twins, and so I delivered the babies early at 28 weeks. One of our twins passed away shortly after birth, and the other is a thriving 5-year-old.
When we found out that we were pregnant, we knew that there was a great chance that they would come early. So at exactly 30 weeks, Kai and Malia were born 10 weeks early. I think the main thing is that it makes you feel very out of control.
Not knowing anything about prematurity before I gave birth, I realized there's not much out there. So when you actually deliver preterm infants, it's not just in the hospital that they're fighting. They fight every day of their lives.
I think in California and the United States, preterm birth is very common, and I wouldn't have known that until I entered the NICU on the day that my children were born.
Although prematurity could be significantly reduced and as much as 75% of preemie deaths could even be prevented, we are seeing some of the worst, most alarming statistics we've ever seen in history. In fact, preterm birth is the leading cause of death in kids under 5 across the world. In California, we have some of the worst rates. There are 15 million preemies born each year. Unfortunately, 1 million don't survive, but of the 14 million that do survive, they face lifelong obstacles. This is an epidemic, and it's one that has been silent for far too long. Because of Mark and Lynn Benioff's generosity and vision, UCSF has the privilege of leading an exciting and important initiative to turn the curve on preterm birth. To do this right, we need to step well outside our comfort zone. We need to look at social, environmental, and behavioral factors just as we do the medical. And we need to take a deep look at how race and equity have profound effects on this critical starting point of life.
I think we need to think holistically about this issue. There has been and continues to be a disconnect to some of the environmental challenges in those neighborhoods. We're not thinking about the social emotional support that are lacking in those communities, domestic violence, and all of the other challenges that those historically distressed communities are facing. I think it'll take us to places that we had not considered.
I feel very strongly about improving research and clinical care in preterm birth. A, because I was a preemie, and B, because it disproportionately impacts Black and brown people. And I really feel like there are modifiable behaviors and modifiable interventions that can improve the impact of preterm birth.
Black babies die at 2 to 3 times the rate of the general population in the first year of life because they are born too soon, and it turns families and women's lives upside down.
It may be twins, high blood pressure, diabetes, what you eat in your diet, in fact, your general health before pregnancy, or how far apart your pregnancies are spaced. But having a healthy pregnancy is so much more than just a medication. That's why, to really turn the curve on preterm birth, it will take a village. It's about having a conversation that includes, first and foremost, the mothers, the families, the communities, along with the providers and the researchers, the policymakers.
I know that our actions at the beginning of someone's life, and even before that, play a critical role in the success of our students. I believe that this initiative will help educate our entire community and will help bring people together who might not normally be involved in an effort like this, from business, from healthcare, from education. We're thinking of the collective whole, and we're setting aside any individual missions and personal agendas, and I'm very confident that we're going to make a significant difference.
UCSF is honored to lead this exciting initiative where we get to look at things differently. This is an opportunity to close the tremendous, unconscionable gap when it comes to birth outcomes, and together with the women and communities who are affected by this disease, profoundly achieving something we could never do on our own.